This is my presentation about attention deficit hyperactivity disorder. I'll first start off with the case study. Uh, Nancy is a 13-year-old grade 8 student currently living at home in Toronto with her two parents and older sister. She was referred to Springboard Clinic for an evaluation to further understand her focusing concerns and her current learning profile of strengths and concerns. Nancy reports that she enjoys arts and crafts and participating in social media websites such as Tumblr. At times, she experiences mood fluctuations and irritability. She noted that anger and frustration tend to be connected with her sadness. Uh, Drawing, listening to music, and swimming help her to relax. Since first entering school, Nancy has experienced difficulties with schoolwork completion, inattentiveness and distractibility, disorganization, impulsivity, and mood fluctuations. Nancy's teachers describe her as hardworking, cooperative student, but they indicate that homework responsibilities have been an issue. They also note that she is very reluctant reader and has consistently scored lower than average on reading comprehension and vocabulary tests. Psychoeducational testing indicated average cognitive abilities. Nancy says that she is struggling to meet expectations at home and at school, complete academic work, and communicate effectively with others who do not share her interests. Nancy indicates that she often becomes anxious when she is asked to speak in public or to spend time with people she doesn't know. Her parents note that Nancy has difficulties making new friends and taking risks. She longs to get invited, but won't make the first move. She experiences ongoing sleep difficulties, primarily with settling into routines at night. There is an extended family history of alcoholism, marital relationship instability, and possible ADHD characteristics. Nancy reports feeling nervous when going to school because of presentations of homework. She describes hating school and experiencing difficulties completing her work on time because she never focuses. Her parents note concern with negative body image and self talk about her performance. So now we'll move on to what is ADHD exactly. So ADHD is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, so they may act out without thinking about what the results will be, or they may be overly reactive. Scientists have no Scientists are studying causes and risk factors in an effect to find better ways to manage and reduce the chances of a person having ADHD. The causes and risk factors of ADHD are unknown, but current research shows that genetics play an important role. Recent studies link genetic factors to ADHD. In addition to genetics, scientists are studying other possible causes and risk factors, including brain injuries, exposure to environmental risks, and even young age. Alcohol and tobacco use during pregnancy, premature delivery, low birth weight, all are contributing factors. Uh, Research does not support the popularly held view that ADHD is caused by eating too much sugar, watching too much television, or parenting, or social and environmental factors such as poverty or family chaos. Of course, many things, including these, might make symptoms worse, especially in certain people, but the evidence is not strong enough to conclude that they are the main cause of ADHD. ADHD can lead to poor self-esteem and social function in children when not appropriately treated. Adults with ADHD may experience poor self-worth, sensitivity towards criticism, and increased self-criticism, possibly stemming from higher levels of criticism throughout life. So there are different types of ADHD. There are three in particular, and they all present differently depending on which types of symptoms are strongest in the individual. There's the inattentive presentation. It's hard for the individual to organize or finish a task, to pay attention to details, or to follow instructions or conversations. The person is easily distracted or forgets about details of daily routines. There's also the hyperactive impulsive presentation. The person fidgets and talks a lot. It is hard to sit still or long for a meal or while doing homework, for example. Smaller children may run, jump, or climb constantly. The individual feels restless and has trouble with impulsivity. Someone who is impulsive may interrupt others a lot, grab things from people, or speak inappropriate times. It is hard for the person to wait their turn or listen to directions. A person with impulsiveness may have more accidents and injuries than others. And then there's the combined and the mixed presentation. Symptoms of the above two types are equally present in this person. Because symptoms can change over time, the presentation may change over time as well. So now we will talk about diagnosing ADHD. So deciding if a child has ADHD is a process with many steps. There is no single test to diagnose ADHD, and many other problems like anxiety, depression, sleep problems, and certain types of learning disabilities can have similar symptoms. One step of the process involves having a medical exam, including hearing and vision tests to rule out other problems with symptoms like ADHD. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of the child from the parents, teachers, and sometimes even the child themselves. If you or your doctor have concerns about the ADHD, you can take your child to a specialist such as a child psychologist or child psychiatrist or developmental pediatrician, or you can contact your local early intervention agency, usually for children under age of 3 or public school 3 or older. A diagnosis is based on the presence of persistent symptoms that have occurred over a period of time and are noticeable over the past 6 months at least. While ADHD can be diagnosed at any age, this disorder begins in childhood. When considering the diagnosis, the symptoms must be present before the individual is 12 years old and must have caused difficulties in more than one setting. For instance, the symptoms can also occur at home. So some of the symptoms, it is normal for children to have trouble focusing and behaving at the same time or another. However, children with ADHD do not grow out of these behaviors usually. The symptoms continue, can be severe, and cause difficulty at school or at home or with friends. A child with ADHD might daydream a lot. They may forget to lose. They may forget or lose things a lot, or they may even forget to complete tasks. They may squirm or fidget. They may talk too much. They may make careless mistakes or take unnecessary risks, and they have a hard time resisting temptation sometimes. They may also have trouble taking turns with their peers. They may also have difficulty getting along with others. Teachers and school staff can provide parents and doctors with information to help evaluate behavior and learning problems and can assist with behavioral training. However, school staff cannot diagnose ADHD, make decisions about the treatment, or require the student to take medications to attend school. Only the doctor can do that. Only parents and guardians can make these decisions with the child's healthcare clinician. ADHD can last into adulthood as well. Some adults have ADHD but have never been diagnosed. The symptoms can cause difficulty at work, home, with relationships. The symptoms may look different at older ages. For example, hyperactivity may appear as extremely restlessness. Symptoms can become more severe when the demands of adulthood increase. So, for some treatment options, in most cases, ADHD is best treated with a combination of behavior therapy and medications. For preschool aged, usually 4 to 5, with ADHD, behavior therapy, particularly training for parents, is recommended as the first line of treatment before medication is tried. First line therapy is stimulant medications such as methylphenidate or Ritalin. What works best can depend on the child and family. Good treatment plans will include close monitoring, follow ups, and making changes if needed along the way. Being healthy is important for all children and can be especially important for children with ADHD. In addition to behavioral therapy and medication, having a healthy lifestyle can make it easier for your child to deal with ADHD symptoms. Here are some healthy behaviors that may help, like, for example, eating healthier, increasing physical activity, and limiting the amount of screen time, such as on TV, computers, and phones and electronics. And doctors also recommend increasing the amount of good quality sleep each night, and that is also based on age. And thank you. Here are my references.